as primary care doctors or healthcare providers, we need to hone in on their story, have that conversation with them at every entrance. How is their mental health? How is their, are they using substance abuse? That is critical because that opens the conversation, keeps the conversation going with them, because without that conversation, we can't be successful for their recovery. My name is Melanie Vandwell. I'm a nurse practitioner here at Hotel Dieu Grace Healthcare. I work in withdrawal management services in which I do medical clearances, which for patients to participate in the withdrawal management program, they have to be cleared, so making sure that they're not intoxicated, there's no medical underlying issues that affect their withdrawal symptoms and management. As a nurse practitioner in the role of withdrawal management service, within that role, I actually do a more or less holistic role where I combine the compassionate care of the support division of Hotel Dieu Grace Healthcare. Within that role, I do medical clearances. With the medical clearances allows me to assess a client holistically, so looking at the biological, the physiological, the social, and the spiritual, their being. With doing that, I actually look and assess to see if they're inappropriate for the program. So if there's any underlying medical issues that affect their withdrawal within 5 days, especially for opiates. I assess also if whether they'll be on a medical assisted treatment. So how when they come to me, are the withdrawal symptoms worse? Like, are they on a scale of 10 where they are drowsy, that I have to send them out to the ER? Or is there medical condition, like if they're jaundiced, I send them out to the ER. So things that are more medically set, that they're inappropriate, then I would send them out to the ER. But my role here is to make sure that everything is under one hub. They can see the medical clearance. They are seen for the medical health, like for a psychiatrist, they have the option of that. And I make sure and I keep that conversation going with them. I listen to their story and I kind of advocate for the psychiatrist because mental health and addiction are kind of one and the same. My role is treating the patient. So what protocol am I going to use? For the opiate protocol, we follow a specific protocol, but if there are other needs that I need to add on to a medication, or if I need to induct like Suboxone, which is a medical assisted treatment for opioid replacement, I work with collaboration with Dr. Levy and Dr. McKay, and we collaborate together to the proper dosing or microdosing to the patient for their stay. And then before they're discharged, they follow up with the proper treatment, whether they're going to go into the RAM clinics and things like that, so the community resources. With my role also, I want to make sure that the patient is able to share their story with me, keep the conversation going. I advocate with them about having the conversation with their primary care doctor, because it's not me that they are going to follow up with, it's their primary care. And if they don't have a primary care doctor, I would make sure that they are the social worker, or actually we have a couple social workers there, or the system navigator will actually facilitate all these services for the client before they leave. So with my second day with these clients, I actually do a follow-up. So I might see like 3 or 4 patients in a day, or 3. But like I said, the intake is quite lengthy. But after I actually see them the next day, I follow up with them and I ask them how they're doing. I assess their symptoms, withdrawal symptoms. If anything is more pronounced for me, I might, modify the treatment a little bit, or might advocate for, if it's an opiate, some Suboxone, things like that, and in consent with the client, obviously. And more health teaching and education. And the piece that I find really connects with them is the change in the chemistry of the client's brain. So more a biological medical piece I speak with them about, where the change in the brain circuits with more opiate use after opiate use after opiate use. What happens is their brain changes, and eventually they can't produce that dopamine anymore, so they actually have to have more of the opioid to get that high. So with that high comes consequences, right? So we damage those centers of the brain, which eventually have long-term effects. When I hone in on that, that's when they realize that, okay, you know what, I have to make the change. So a change in behavior, they speak to me about that. And again, as a team, we collaborate and we focus in on what their goal is after withdrawal management. Also, withdrawal management will focus with the Hotel Dieu Grace Healthcare in collaboration with partnerships in the community. We do have lots of community access. So it's important for us to hone in on the community conversation about opioid addiction. If we stick with the same old school, as in not talking about the addiction and where it stems from their stories, how these patients are actually affected by their story. Their story tells us that we need to have more conversations because they're using drugs to self-medicate themselves to deal with their story. Sometimes people haven't dealt with that issue and they open up and they're telling me their story, they cry, they're like, I've never done that before. And so I tell them, tell your story. We need to help them through and get them treatment if it's mental health issues, depression, anxiety. Sometimes post-traumatic stress disorder is very prominent in addiction. So having a focus and being open with them and, you know, just listening to their story is where we need to go. Because without that conversation, we can't be successful for their recovery.